You want to make sure you follow the surgical protocol. I would be extremely conservative until you get a surgical protocol to ensure you're not doing anything you shouldn't. And this is for medical legal reasons, right? You don't want to have, you don't want to do something completely against what the surgeon wants. Then that risk is all going to follow on you. If there's any sort of medical complication in the future, you can get sued for that. It's not a great thing. All right. The other thing that one great way to destroy your relationship with local surgeons is to do something they don't want you to do. Okay. A lot of surgeons are already very concerned with physical therapists. A lot of docs think that the physical therapist is going to ruin the surgery that they just worked very hard on. So if you start doing things that are a little bit early in the physician's mind, they're going to stop referring patients to you, right? Which is obviously not a good thing. You rely on those patients for your business. Okay. And if you do have questions or concerns about the protocol, just communicate with the doctor. Okay. So one of the surgeons locally that I really like, on his protocol, it says week 12, start to introduce agility drills, right? Now, 2 pages down from the same exact protocol, it says we don't want you to start running until month 5. Okay. So week 12 for agility drills is quite fast. And generally speaking, agility drills are going to be more stressful on the joint than slow, kind of like straight ahead running. Okay. So this makes no sense. So if you just talk to the doc and just let them know, and say, hey, I'm a little concerned about this. I think it's a little early to introduce this at week 12. However, I'd like to introduce some impact and we speed up that running progression a little bit sooner. Oftentimes like, oh yeah, no problem. I didn't realize my protocol said that. Okay. So the communication is really important. Unfortunately, sometimes it's hard to communicate with doctors. What I will say is that over the course of your career, continue working with the doctors that communicate well, because that's going to improve your patient outcomes. It's going to improve rapport. They're more likely to refer to you. And what does happen over the course of time is you get so many referrals from the docs you like and less referrals from the docs you don't like, that your job gets a lot easier, plus your outcomes improve, right? Because the docs that don't communicate typically aren't going to refer a ton of patients to you anyway, right? So if you don't have good rapport built with the surgeons you're working with, I recommend trying to build that trust a little bit before you go and, tell the surgeon that their protocol stinks, right? What I do, what I found to be very useful, is I actually go to the patient appointments. So let's say I have a patient that comes in 2 days after labral repair, you're doing physical therapy. I say, hey, you know what? I'd like to talk to the doc. I have some questions. Can I join you on your next appointment, right? At your, 10-day appointment, whatever it is. You go with the patient to their appointment. You're there one-on-one with the doctor and the patient. What that does is that the surgeon's like, wow, this physical therapist really cares about the patient, right? And the patient feels the same. They're really happy that you're there sharing with the process. Now, I know it's hard to do this as a busy professional, but I think at the end, it does reap the reward, and you don't have to do it with all your patients, maybe with a couple, just to kind of get to know the surgeon a little bit better, build that rapport. And then what happens is they're more likely to refer patients back to you. So if you like working with hips, you want that business, that's a great business move as well. Okay. And lastly, you can always email and call the surgeon, right? Sometimes you won't get the surgeon directly. You'll probably be able to contact the MA. And at the very least, you'll be able to get the post-op report as well as any protocol that the physician likes to use. And that's good enough to get started, all right? So if you don't have all your questions answered, you can get a lot of that answered just by talking to the MA, which is easy to contact them. They'll give you the post-op report. They'll give you the protocol if it exists, right? So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt. They want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.